Good afternoon. My name is Mairead Keane, and today I want to talk to you about something I believe many of us are navigating: a rapidly growing industry and a growing gap in how prepared we are to operate confidently across state lines. My capstone project proposal is the development of a state regulatory crosswalk, a strategic tool designed to help regional support teams operate with greater clarity, confidence, and compliance in every state an organization serves. I'm going to walk you through what's driving this need, what the potential tool would look like, how we'd build it, and how we'd know it's working. Here is an overview of how I approached this challenge and my proposed solution, as well as the areas I will cover. The demand for quality assisted living communities is growing. As organizations respond to that demand, they expand. That expansion happens in many ways, including new construction and acquisitions. Both of those pathways potentially lead us into states where often neither the organization nor its support team has previously operated. Regulatory expertise isn't something you can download overnight. It's built through years of career exposure, years of working in a specific state, learning its nuances, understanding what surveyors prioritize, and knowing where the risk actually lives. When a regional support team is suddenly covering 5 or 6 states, some of which are brand new to them, that depth of knowledge simply doesn't exist yet. And that gap creates compounding risk across communities, residents, and the organization as a whole. When support teams don't feel confident in a state's regulations, they avoid them. It's human nature. They default to what they know: organizational processes, familiar workflows, and they stay away from state-specific requirements they don't feel equipped to address. The result is a cycle that feeds on itself. Low confidence leads to avoidance. Avoidance leads to gaps in training, onboarding, and community support. Those gaps show up in state surveys. Survey findings, especially repeat findings, have real operational implications. And all of that pressure builds into stress, burnout, and turnover. People don't need more information. They need the right information organized in a way that tells them exactly what to focus on and where the risk is. This isn't just a compliance problem. It touches every level of the organization. Executive directors and clinical directors are often the ones left carrying the weight of this challenge. They're expected to be compliant with state regulations they may not fully understand, without a clear framework for what's expected of them in their specific state. When support teams can't provide that clarity, leaders feel unsupported. Often this leads to turnover. Turnover in these roles is already one of the most persistent challenges in our industry, and lack of support and unclear expectations are consistently among the top reasons people cite when they go. Associates and staff experience this through inconsistent onboarding and training. The gaps in regulatory education show up in how care is delivered. Residents are ultimately who we're here to serve. The quality of their care is directly tied to how knowledgeable and confident the people supporting them are. Survey findings aren't just a paperwork problem. They reflect what's actually happening in the community. And at an organizational level, regulatory risk that isn't managed at the community level doesn't stay there. It escalates, it becomes a systemic issue, and when growth is outpacing our compliance infrastructure, that risk multiplies. I'm proposing we build a state regulatory crosswalk, a structured, standardized matrix that maps the regulatory requirements across all states an organization operates in, identifies where those requirements differ, and flags the areas of highest compliance risk. What would make this initiative different from simply pulling together a reference document is it would be built using AI and industry experts working together. Why does that matter? Because AI allows us to do in weeks what would otherwise take months. It can process regulatory language across multiple states simultaneously, identify patterns and differences, and help us stay current as regulations change over time. Industry experts bring the contextual knowledge. They know what surveyors actually focus on, what surveyor hot-button issues look like in practice, and where the real-world risk lives beyond what's written in the regulation itself. Together, that combination produces something more powerful than either could do alone, a tool that is accurate, actionable, and built to evolve. The crosswalk would map regulatory differences across states, flag high-risk compliance areas, and give regional teams clear, prioritized guidance. Here's how we would get there. The initial build is structured across 3 phases over roughly 90 to 120 days. Phase 1 is research and collaboration. We start by identifying the regulatory sources for all applicable states. We also look at survey data to define the top 5 most cited deficiencies per state, and we map out those surveyor hot buttons, the things that consistently draw attention during surveys in each state. This phase is about making sure we're building the right thing before we build anything. Phase 2 is where we build. Using AI tools alongside subject matter experts, we map our organizational baseline standards against each state's specific requirements. The categories we focus on are the ones that matter the most. For example, resident care and medication management, staffing requirements, documentation, life safety, training requirements, and quality assurance. Every area where state regulations differ from our organizational standard gets identified and documented clearly. Phase 3 is the pilot. Before we roll this out broadly, we test it in the real world. We select 2 or 3 regions across multiple states and put the tool to work during mock audits and regional site visits. And then we listen. What's confusing? What's missing? What actually changed how someone approached their work? That feedback shapes the final version before full deployment. These are an example of the categories the crosswalk will be built around. These are areas where state-specific variation is most likely to create compliance risk and where avoidance or lack of understanding have big impacts. Resident care, this includes how medications are managed, how assessments are conducted and documented. Staffing requirements includes ratios, qualifications, and scheduling rules that may vary by state. Documentation would include what records are required, how care plans must be structured, and how incidents must be reported. Life safety would review the physical environment standards and emergency protocols that differ across regulatory bodies. Training requirements would include the hours, topics, and competencies required of each state, and quality assurance would review the QA processes and performance monitoring standards that are required by each state. For each of these areas, the crosswalk will show clearly, here is what we do as an organization, and here is what each state requires on top of that, or differently from that. A tool is only as good as the people who use it. So how do we make sure this actually gets adopted? The key is framing it around what matters to the people we're asking to use it. For regional leaders, the message is simple. This will provide support and clarity in your day-to-day operations and improve your impact among the teams and communities you support. For executive directors and clinical directors, it's about enhancing education and knowledge and reducing risk exposure. For everyone, it means knowing what to focus on and fast, instead of trying to navigate complex regulatory language on your own. But more important than the messaging is the approach, which is co-creation. This crosswalk should not be built in a vacuum and handed down. The people who know the challenges best are the ones living them every day. Regional leaders, executive directors, resident care directors, and staff. They need to be part of defining the risk levels, identifying gaps in education, and shaping the tool itself. We know that when people help build something, they trust it. And when they trust it, they use it. To track if the tool is working, we will review several areas. We'll track crosswalk adoption. How many regions are actually using the tool during internal audits, onboarding, and site visits? Usage is the leading indicator of everything else. We'll monitor compliance accuracy. whether the tool is helping teams understand regulatory requirements and are they able to operationalize them. We'll also look at survey performance over time. Are findings decreasing? Are repeat findings becoming less common? We'll measure leader confidence, because confidence is what drives engagement, and disengagement is what drove the problem in the first place. Longer term, we'll watch leader retention, executive director and clinical director turnover, because if the crosswalk is doing its job of reducing the feeling of being unsupported, we should see that show up in retention numbers over time. And we'll look at community support quality. Are onboarding and education improving? Are communities feeling better prepared? Some of these results will come quickly. Others, like retention, are longer-term data points. I want to close with the why behind all of this. In my career, I have always been passionate about education, community support, compliance, and building confidence through knowledge. Confident leaders and compliant communities equal better resident care. And that's what this is really about. It isn't about a spreadsheet or a compliance checklist. It's an investment in the people who show up every day to support some of the most vulnerable members of our communities. When we give teams a clear, confident foundation and the regulations that govern the states they work in, everything gets better. Surveys go better, communities run more smoothly, leaders feel supported, and the residents in our community receive the quality care they deserve. The state regulatory crosswalk, built with AI and the expertise of the people closest to the work, is how we close the gap, systematically, sustainably, and with the clarity our teams have been asking for. Thank you.